then I move in like this. This is now flail. But if the cord was just elongated, then we have this. You understand what's happening? So this is now mitral valve prolapse. This is where it's supposed to close in a straight line. Does that make sense? Okay? All right, so the apparatus, we know if the apparatus is non-functional, we expect disease. If you have a broken or a detached papillary muscle, then again you're going to have the flail, but this time you're going to see the detached muscle at the tips of the flail. All right? What causes the muscle to detach? You have to ask that question. I'm speaking to you from the Cardiotech Ultrasound School, which is located at 12135 Bissonnet, between Cook and Cookwood in southwest Houston. This school is very different from most schools in the area because our classrooms are really small. The maximum students in a class is 15. It ranges from 8 to 15 every semester, so you get more of a one-on-one education. We have high retention rate. We have very qualified instructors. Most of them come to us with an MD degree because our base is science. Our students pass the national exams with no flaws whatsoever. We are in the top 10% in the country. And therefore, because you can pass your registry exam in these fields which we bring to you, ultrasound, which are cardiac ultrasound, we also offer you vascular ultrasound, and that's an associate degree. It takes less than 2 years to complete. We also do diagnostic ultrasound, which is for the embarrassa. In other words, it's for the babies, it's for your stomach, it's for your liver, your kidney, blood vessels. We do all those types of ultrasound as well as we do EKGs. The school has been here since 2002, and as you see, we do not do any commercials from the way I behave in this one. So we also offer you federal funding. If you qualify, you can get a Pell Grant. If not, you can apply for federal loan at low interest. We have full-fledged labs with multiple machines that you can practice, and we coordinate our lectures with our lab practical work. You're in school basically 1 year before we send you out to the clinical sites where you would do additional practices. We send you to some of the best sites in Houston, including the Methodist Hospital, Herman Memorial System, the HCA hospitals, as well as St. Luke's, both in the Med Center and in the Sugar Land area.
Say, oh, whatever, it hurts so bad, whatever, but I know it's like 3/10 on the scale. But he's exaggerating and saying it's 10/10. So we were trained to know from the body language who's right and who's not. So do not lie, do not play that game. Be honest and say the truth from the beginning. Why are you guys looking there? Oh. Okay, so that's what Listen. Honesty is a must in the medical field. Lying, trying to get yourself out of problems by fabricating a story, by constructing an excuse, they will figure it out. Maybe after a day, maybe after 2 days, maybe after a week, they will figure out that you lied, and now they're not going to trust you anymore. If you lie to me as a physician, then you may lie to my patient, and that may cause some problems, and I may get sued for that. So I don't need you. Another thing that you have to avoid. The next is evasion. What is evasion? The sonographer should not focus patients' attention on their signs or symptoms simply to reassure them or to avoid being questioned about whether they are going to die. Now here we have 2 points to explain. The first is, if the patient asks you, and that was in one of the quizzes before, if the patient asks you, D, why you think so?
D.
Yes, that's the right answer. C is what? No, but not today. Or his concerns, his fears, whatever he's going through, why he's thinking of death at that point. And then you tell the patient, we gotta take care of you, doctor, whoever's gonna take care of you, you are in the right place. You don't try to get the patient's attention to his symptoms and signs just to avoid answering questions. For example, your patient while you are scanning is asking a lot of questions. And you felt irritated, so you think, okay, let me play the game in a smart way. Mr. Johns, you still have the chest pain? What you are doing now is you are trying to take the patient's attention away from his question to his symptom. You are distracting the patient so that you avoid answering the questions. That is not acceptable. Again, as we said, if the questions are related to what you are
Cardiotech Ultrasound School is a great school. It's a wonderful program. You train to become a sonographer in less than 2 years. You have teachers that will help you, so do not give up. It's very, very worth it in the end. We have actual machines where you get hands-on experience, and it is just wonderful. And it's been making me feel very, very, very good, and I'm almost done with it, and I can't wait to start working in the hospitals. Like, it's worth it, guys. You have to come and do it.
Hi, my name is Tiffany, and I'm at Cardiotech and Ultrasound School. This is my first year, third semester. I am majoring in applied science and vascular sonography. And the reason I would suggest that you come to this school because you do have instructors that are able to help you hands-on. They are very good at what they do. And also, if you have any questions, they take out the extra time with you to make sure you understand it. As far as scanning, it's a great process because we have multiple machines to work on. So when we do go into the work field, we'll be prepared and ready, well-informed. So come out and join us. I'm ready to start clinicals next year, and it's a great opportunity, so take advantage of it. Thank you.
Hello, this is MD Alom. I am come from Bangladesh. I came here to study and I look through Houston, different colleges like ACC, Lone Star College, Sanfran Brown, and Cardiac Ultrasound. But I found this is the good school because everything is everything is good. Here is the teachers are very excellent. They teach us what we need actually, and the director is really she is excellent. She has always helping hand. And the environment is very, very, very nice. And the curriculum, I think this is the best curriculum. When you finish the school, we can take the registry exam, and most of the students pass the registry exam. That's the best school for us.
Hi, my name is Leslie Brewer, and this is Cardiotech Ultrasound School, where we do a lot of advanced learning in ultrasound, and where we start is anatomy and physiology, and we eventually go to ultrasound physics and the echocardiography vascular lab, and eventually we could work at the hospital, and we switched to a new exciting career in sonography. And here we do a lot of hands-on learning with the professors. We're very personal. The classroom sizes are very small, and this would be a great school for anyone to go to. I love the decision that I made to go here.
من نیلوفر نعمت‌زاده هستم و تازه به امریکا اومدم و این مدرسه رو انتخاب کردم به خاطر دوره اکوی قلب و قبل از اینکه به این مدرسه بیام اول تحقیق کردم در مورد رشته‌ای رو که می‌خواستم بخونم و متوجه شدم که این مدرسه این دوره اکوی قلب رو هم خیلی خوب یاد میدن، هم با ما بیشتر کار میکنن که عملی خیلی چیزا رو بهتر یاد بگیریم و خیلی هم راحت‌تر معرفیتون میکنن به اینکه کدوم کلینیکال برای هاسپیتال براتون بهتر باشه که بخواین برین و قبل از اینم که کلینیکالتون رو شروع بکنین خیلی خوب ترین میدن شما رو.
Hola, me llamo Reina y estudio en la escuela de Cardiotech School. Y la razón que escogí esta escuela porque sé que tengo muchas oportunidades y también tengo oportunidades de salir con en otros hospitales y tener muchas experiencias. Es muy diferente comparadamente de otras escuelas donde nomás haces mucho en el libro en vez de tener más en hands-on, y tenemos muchas oportunidades ahí a salir, a encontrar muchos más trabajos.
Hi, my name is Deron Blaze with Cardiotech Ultrasound School. If you're looking for a new career, this is the place to be. Financial aid and student loan is also available. Come by and see us.